guys, you want to learn how to perform CPR? There's 4 major steps you need to follow at the beginning. 1, check your surroundings. Make sure there's nothing dangerous around you and you're in a good area. 2, check for responsiveness. See if you can get any movement, any words, anything from the person. If not, you need to call 911. If you personally can't call 911, get someone around you to do so. In the meantime, check if they're breathing. Check for any chest rises, anything. This person's not, so I know I need to perform CPR. All right, now you know you need to perform CPR, but we're gonna start with compressions. So what you wanna first do is make sure that they're in a hard, flat surface where you can easily do it. Now you wanna make sure you go in between the nipple line when you perform it. You wanna do 30 compressions in 15 to 18 seconds, and you wanna do 100 to 120 beats per minute. You wanna also make sure you go 2 to 2.4 inches down, but allow for recoil. All right, now it's time to do breathing. So you first want to do is put your hand on their forehead and underneath their chin as well, and you tilt back. You're checking to see if there's anything in the airways. If so, get it. But if not, you know you have to do some breaths. You want to pinch their nose as it's still tilted back and perform 2 breaths. Then you want to do your compressions again. You want to make sure you can do 2 breaths within 10 seconds. And now I have to keep doing my compressions. All right, well, let's talk barriers. So one barrier is really handy. You should always keep one around you in your car, in your house, because you never know when you'll need it. It's a piece of plastic with a valve in the middle. What you do is you place this over the person's mouth and you tilt back and do the same thing again. And keep performing your compressions. Number 2 is this handy dandy plastic piece that has some rubber part underneath, and you place it right on their nose, tilt back again, and it covers their mouth and nose, and you continue to do the same thing and then perform compressions. In the same area in between the nipple line. If you don't have barriers, always do compressions. You don't have to do that with the mouth because you need the barrier, but continue to always do the 30 compressions. You still can save someone's life. All right, now we're gonna learn how to use an AED. So this pretty much does it for you, but you have to make sure you set it up correct and follow what they tell you to do. This one, the stickers tell me where I need to place it. So I know I need to place this one on this lower side, right underneath here. Then I know I need to place this one up here. They tell me on the sticky. So now I let the machine go. I turn it on the green button, and I follow the instructions.
Analyzing heart rhythm. Do not touch the patient.
You want to make sure you stay clear and back.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
So now I know I have to continue doing my CPR because this did not work. You'll continue doing this every 2 minutes. All right, so for a small recap, 1, make sure you tilt their head back and give 2 breaths. Now 30 compressions. It's always breath, compressions, breath, compressions. You continue to do that until help arrives or you save their life. All right, everyone. Well, you learned how to do CPR and use an AED. So for a small recap again, you know you want to do 2 breaths for 30 compressions. So remember, you tilt their head back, pinch the nose, and then continue with the compressions. I hope this video was able to help you and that you can save someone's life one day. Bye.